Do you know what a UTI is? UTI, or urinary tract infection, is a common health problem that affects millions of people each year. It's a condition that occurs when bacteria invade any part of our urinary system, which includes the kidneys, bladder, ureters, and urethra. This infection can cause various discomforts, and if left untreated, it can lead to serious health issues. But don't worry, understanding is the first step towards prevention and treatment. Let's dive deeper into this topic and learn more about the different types of UTIs. There are several types of UTIs, each affecting different parts of the urinary system. Let's start with cystitis, a common type that targets the bladder. This usually occurs when bacteria make their way up the urethra and into the bladder, causing inflammation. Next is pyelonephritis, which is a kidney infection. This often happens when bacteria travels from the bladder up to one or both kidneys, causing symptoms like back pain and fever. Then we have urethritis, an infection of the urethra. This can occur when bacteria from the digestive tract spread to the urethra or due to sexually transmitted infections. Lastly, there's ureteritis, an infection of the ureters, the tubes that carry urine from the kidneys to the bladder. This is less common but can occur due to bacterial infections or certain medical conditions. These are the main types of UTIs, each with its own causes and symptoms. Now that we know the types of UTIs, let's move on to the symptoms you should be aware of. UTIs can have a variety of symptoms, some more noticeable than others. The signs of a urinary tract infection often include a strong, persistent urge to urinate. It's as if you constantly feel the call of nature, even when you've just emptied your bladder. Another common symptom is a burning sensation during urination. This isn't your typical discomfort, but a stinging or burning that can be quite unsettling. The appearance of your urine might also change. It may become cloudy, almost like a foggy day in a bottle. Sometimes it might even have a strong, pungent smell, far from the usual. Lastly, lower abdominal pain is another symptom to watch out for. This is a dull, persistent pain that sits right below your belly button, making even simple tasks feel cumbersome. Remember, these symptoms might not all appear at once, and some might be more pronounced than others. If you're experiencing these symptoms, you might be wondering, what causes UTIs? Let's find out. UTIs are usually caused by bacteria entering the urinary tract. These pesky invaders typically sneak in through the urethra, which is the tube that carries urine from your bladder to the outside world. From the urethra, they can ascend into the bladder, and if left unchecked, they can even make their way up to the kidneys. This bacterial migration is what leads to the infection we refer to as a urinary tract infection. Now let's talk about the risk factors that can make you more susceptible to UTIs. One of the most common risk factors is sexual activity. This can introduce bacteria into the urinary tract, particularly in women. Certain types of birth control like diaphragms or spermicidal agents can also increase the risk. As women age, menopause can become another risk factor. That's because the decrease in circulating estrogen can make the urinary tract more vulnerable to infection. Urinary tract abnormalities, such as kidney stones or an enlarged prostate, can slow the flow of urine and give bacteria more time to grow. Similarly, a suppressed immune system, due to conditions like diabetes or HIV, can make it harder for your body to fight off these infections. There are other risk factors too, like having a urinary catheter or even just being female. Women are more likely to get UTIs than men. Knowing the causes and risk factors can help in preventing UTIs. But what if you already have a UTI? What are your treatment options? We'll dive into that in our next section. If you think you have a UTI, it's important to seek medical help. When it comes to treating urinary tract infections, the most common course of action is the use of antibiotics. These medications target the bacteria causing the infection, helping your body to fight off the intrusion more effectively. Your doctor will prescribe the best-suited antibiotic for your condition, so make sure to follow their advice diligently. Apart from antibiotics, you can also use over-the-counter pain relievers to help manage any discomfort or pain that comes with a UTI. Remember that these treatments are designed to alleviate symptoms, not to cure the infection itself. In addition, staying hydrated is another crucial component of treatment. Drinking plenty of water helps to flush out the bacteria from your system, speeding up the healing process. Remember, it's always best to consult with a healthcare professional for accurate diagnosis and treatment. Treatment is crucial, but prevention is always better than cure. How can we prevent UTIs? There are several ways to reduce your risk of developing a UTI. Let's delve into some practical tips that you can incorporate into your lifestyle. First off, ensure you're drinking plenty of fluids. This aids in flushing out bacteria, keeping your urinary tract healthy. Now don't hold it in. Make a habit of urinating regularly, especially after sexual activity, as this can help to clear bacteria that may have entered the urethra. Next, your choice of clothing can also make a difference. Opt for breathable underwear, preferably cotton, as it can help keep the area around the urethra dry, reducing the chances of bacterial growth. Lastly, but certainly not least, practicing good hygiene is crucial. This includes wiping from front to back after using the bathroom to prevent bacteria from the anal region from spreading to the urethra. By following these tips, you can significantly reduce your risk of UTIs. UTIs are common, but they can be prevented and treated. Armed with knowledge about the types, symptoms, causes, and risk factors, you're better equipped to protect yourself. Effective treatments are available and preventive measures can minimize your risk. Remember, if you're experiencing symptoms of a UTI, it's important to seek medical help. Stay healthy and take care of your urinary system.